Bonjour, Monsieur le Ministre, Monsieur le Professeur,
Good morning, everybody.
Madame.
Mr. Minister, ladies and gentlemen, administrators of the Foundation, dear colleagues, dear friends. It is a true privilege for me to be with you all today. Because of the fact that the time that I have is rather short, I'll try to be as brief as possible, but please do not hesitate to ask me to speed up if necessary. I would like to talk to you briefly about the problems of health in Africa and the international commitments at the international level to UHC. The agenda of development is now universal and applies to all the countries of the world. Out of the 8 objectives of the millennium that had been adopted for 2000-2015 that applied only to developing countries, only 3 were about health: reducing child mortality, improve maternal health, and fight against HIV and AIDS, malaria, tuberculosis, and other diseases. Now, only 1 out of 17 objectives are explicitly about health. The fact that we see more and more in the media that we're talking about climate questions and the degradation of the environment, at the same time of the Paris 2015 World Conference on Climate, can explain that only 3 out of the 17 Sustainable Development Objectives are specifically linked to climate and environmental questions. However, historical questions regarding health, like child and maternal health, nutrition, transmittable diseases like malaria, tuberculosis, HIV and AIDS, etc., that contributed to lowering the life expectancy in the various countries that I already talked about, are far from being resolved, especially in Africa. It's difficult to catch up for them, contrary to what we're seeing in Asia, for instance. Africa is lagging behind due to insufficient human and financial means, which is worsened by the poor performance of the health systems and the growth of the demographic growth, which lead to the propagation of the Ebola virus epidemic and other infections. Some countries are also impacted by armed conflicts, which worsen the health situation due to the fact that these health systems are disorganized, people are being displaced, and there's a lot of violence that has an impact on the health staff and the population in general. All these problems in public health are continuing on top of environmental and climate problems and call for strategic, technical, and financial responses. But the health risk for these countries and for the whole world are due to the weaknesses of the national health system, which cannot detect and react quickly and efficiently to the new epidemics. The fact that we're relatively controlling the Ebola epidemic should not hide the fact that it's a very weak control. The countries and the international communities did whatever they could as quickly as possible. In the field and on the ground, political and institutional measures over the longer or medium term are the political responsibility of the national authorities and international authorities, and they are not up to par with what is at stake. The international financing is far from being enough in order to develop robust and reliable healthcare systems. If the international community although the international community managed to get together over the last 15 years in order to create the Global Fund to fight against AIDS, tuberculosis, and malaria, the World Alliance for vaccination and immunization, Gavi, and we also have PEPFAR and the Clinton Foundation, the Bill and Melinda Gates Foundation, the Carter Foundation, the Mary Irvin Foundation, in order to fight against AIDS and other infection diseases. We all need to understand that the national healthcare systems have only been slightly strengthened. And that's why whole areas of the healthcare systems are not covered by all this. When new scourges linked to the modernization and urbanization, like chronic diseases, non-transmittable diseases, and traffic accidents, continue to be a burden for weak and poor countries. Also, although we have health information systems that have been in place for over 2 decades, data analysis is still not enough. We need to improve it, making sure that it is capable and efficient. It is absolutely crucial to understand the impact of the demographic growth in Africa, because it's currently unheard of. We also need to understand the migration phenomena, which have an impact on social and food demand. So what is at stake when we're talking about promoting health in Africa? We need to understand that the regional healthcare systems can include all political strategies, which is absolutely crucial to promote health. This will make it possible to leverage all the resources that are already in place in other sectors such as education, urbanization, agriculture, water, sanitation, public transportation and work, employment, etc. In a context where resources are limited, the regional healthcare systems are asking for 15% of the national budget to be allocated to health. Let me remind you of the Abuja Declaration. And that's how we will be able to actually leverage all the efforts that are done in health and in other non-health sectors, making it possible to get more from the results together with the resources that are currently available. Wouldn't it be in other sectors that financing should be increased? The resources that are currently available in the health sectors will have to be dedicated mostly to the diseases that could not be taken care of considering the current system. As I said, 15% of the national budget should be dedicated to health. Africa can gain everything by integrating the promotion of health as part of its government authorities and in society in order to invest much more efficiently for health. It's not going to be easy in Francophone Africa, where we already have a number of problems that we need to overcome. However, it is necessary to improve health and well-being of the people. It is absolutely crucial in order to fill in the gaps and boost the performance by strategically planning, coordinating, and assessing these efforts. Scientific reflection on what is at stake in terms of health is absolutely crucial. We need to highlight that we do not have enough experts in terms of strategic planning in international conferences. They could basically help us extend these networks, and that would be an added value for the various countries. Social protection is a good thing for development and for the economy. The Bachelet report actually highlighted 2 things. First of all, the fact that social protection becomes even more necessary because of the economic difficulties and also because it can contribute to prevent the repetition of crises and human tragedies. The global objective is to promote a whole series of rights and basic social transfers, essential services in terms of employment, health, water and sanitation, nutrition, education, support to families, etc., dedicated to protect, empower, and help the poorest to get out of poverty, including in terms of employment. Also, the social policies must be done in a consistent manner throughout life and have an impact on the most vulnerable categories of societies. We need to ensure basic income to live and make sure that the population is going to have access to essential social care. Universal health coverage is supposed to make sure that all people will have access to health services, the health services that they need, without causing financial difficulties for them. In order to do that, several essential factors need to be met. A robust, efficient, and well-managed healthcare systems that meets the priority health needs of the people who need it the most, including services dedicated to HIV, tuberculosis, malaria, non-transmittable diseases, and child and maternal health. By informing the people and encouraging them to remain in good health and prevent diseases, by screening very early the various health problems, by making sure that they have the means to treat their diseases and giving them rehabilitation services. All these services need to have an affordable cost, and we need to protect the people against expenditures and out-of-pocket expenses, as the Americans like to call them, because it ends up condemns them to poverty, which ultimately would go against what we're trying to accomplish. Access to drugs and technologies is essential to have a diagnostic of and treat medical problems. Sufficient staff needs to be trained and motivated to provide these services and meet the needs of the patients by using the best available factual data. The essential role played by other sectors, whether transportation, education, or urban planning, including outreach services, has to be highlighted. UHC has a direct impact on health and the people, making these people more productive, making it possible for them to better get involved in family and community health. It facilitates schooling and education of children, who in the end also become agents of prevention. UHC is an essential component of sustainable development and the fight against poverty. It is proof of the commitment of the public authorities to improve the well-being of all citizens. UHC is anchored in the Constitution of the WHO, adopted in 1948, that makes health a fundamental right of any human being. The General Assembly of the United Nations noticed that despite important progress, including in Africa, we needed to do a lot more for sustainable development and give the people the means to live a healthy life. Significant progress had been accomplished. For instance, better life expectancy and reduction of major causes for child and maternal death. A lot of progress has also been accomplished in terms of access to clean water, sanitation, reduction of malaria and tuberculosis, polio, and HIV and AIDS. But there's still a lot more that needs to be done. The General Director of the WHO, Dr. Tedros Adhanom Ghebreyesus, and I apologize to my Egyptian colleague if I do not pronounce his name correctly, highlighted how important it is for our member states to dedicate to healthcare everything that they can in order to implement these international healthcare services. What the world promised in 1948, health for all, when the WHO was created, is true today, but half the population does not have access to health care and universal health coverage. I believe that now it is time to go beyond words and to start working on actions. The whole world is requiring it. Health as a matter of rights, as an end in itself, he said. It's a leitmotif that needs to be at the very center of the WHO. Universal healthcare is supported by the Constitution of the WHO in 1948 and the Declaration of Alma Mater in 1978. This means that the countries need to follow the progress not only in the population but also in its various categories: income, gender, age, domicile, migration status, and ethnic origin. UHC associates two key elements. The first one, the use by the population of healthcare services that it needs, and the second one being the economic consequences of such a use. The first objective means that everybody needs to have access to a large spectrum of healthcare services, including promotion, prevention, treatment, rehabilitation, and palliative care. These services need to be of good quality because there's absolutely no need in using a scanner that is not set up properly or handled by a healthcare agent that is unqualified. And obviously we need to highlight the fact that everybody must get the treatment that they need, and obviously the objective is equity. Second objective, protection against the financial risk that is linked to obtaining this care. The fact that you have to pay for your care discourages population to get access to the services and can cause financial problems for those that do. For instance, to avoid this problem, taxes is a good example of this. The contributions need to correspond to the capacity of each individual to pay for the care, and therefore subsidies will always be necessary for the poorest and most vulnerable populations. The fact that we have limited resources for health means that we had to dig deeper in order to understand how healthcare services are funded. In order to reach UHC, governments will try to have mechanisms of improved expenditures that are more appropriate for health and to promote financial security of the households. It is absolutely crucial to share best practices and the experiences of the whole world in order to understand how we can improve all of this. After the conclusions that were drawn by the G20 in Cannes in November of 2011, the General Assembly of the United Nations adopted on December the 12th, 2012, supported by France and the group called Diplomacy and Health, supported by the Ministry of Foreign Affairs of South Africa, Brazil, France, Indonesia, Senegal, Thailand, and Norway, a resolution to support UHC. It was a small but significant revolution at that time that was supported by the NGOs and the advocates of the civil society. That was a new milestone toward the right of health for all. This was co-supported by over 90 countries. This resolution is now proof of the commitment of the international community to extend the social protection systems for health, and France obviously is contributing to strengthening the social dimension of globalization. Let me, however, remind you of a quote of the British journal called The Lancet on September the 8th of 2012 that highlighted the fact that it's not a matter of knowing if the countries will commit or not towards UHC, but how they're going to do this. And very pragmatically, they added that universal health coverage is an opportunity without obviously being a guarantee of progress. It belongs to us to make a difference. Thank you.